Hello, thanks for joining the webinar today. Feel free to introduce yourself in the chat by writing your name, title, and facility or district. We're currently waiting for a few more people to join. In the meantime, if you have any questions or comments now, feel free to write them out in the chat box or the Q&A box. There will also be a live question and answer session after the webinar. Welcome to the Clean Classrooms for Carolina Kids pre-enrollment webinar. I'm Jennifer Hopenick-Redmond, the program director. This program is a partnership between RTI International, an independent nonprofit research institute, and the North Carolina Department of Health and Human Services, along with the North Carolina Department of Public Instruction as a liaison. Together with my colleagues, including Lisa Green, this webinar will overview information about the program and how to enroll. At the end of the webinar, we will give you a PIN to access the online enrollment portal. We will also have a live question and answer session. If you have any questions or comments during the webinar, feel free to write them in the chat or the Q&A box. Okay, let's begin. The North Carolina Department of Health and Human Services has been contracting with RTI International since 2020 for the Clean Water for Carolina Kids program to identify and eliminate exposure to lead in water at licensed child care facilities across North Carolina. This work is being expanded to the Clean Classrooms for Carolina Kids program to identify and restrict or mitigate exposure to lead in water, lead-based paint, and asbestos hazards at both public schools and child care facilities across North Carolina. For this program, we are building off our award-winning community-engaged approach to improve children's environmental health in child care and school facilities. To date, we have received several awards from Harvard University, the Environmental Business Journal, and Mutual of America, recognizing our multi-sectoral partnership to advance children's environmental health in the state. Today, our webinar covers lead and asbestos background, the program overview, how to participate in the water, lead-based paint, and asbestos sections of the program, and preparing for enrollment. We will let you know what personnel and information is needed to participate and wrap up with a live Q&A session. First, why are we focused on lead and asbestos? Well, both lead and asbestos have been used in building materials. For lead-based paint, it was primarily used in buildings before 1978 in interiors, exteriors, door frames, stairs, railings, windows, and windowsills. Lead is also used in water infrastructure, including piping, plumbing, fixtures, and solder. Initial restrictions on lead went into effect in 1988, with 8% or less of lead in piping and plumbing and 0.2% in solder considered lead-free. Since 2014, lead-free water infrastructure is defined as 0.25% lead or below. Asbestos has also been used in building materials, especially before 1988. It can be found in pipe and duct insulation, building insulation and fireproofing, wall or ceiling joint compound, HVAC systems, sprayed or textured coatings, roofing materials, cement pipes, putty and caulk around windows, and exterior siding and undersheeting, wall plaster, and ceiling and floor tiles. Exposure to lead and asbestos is a public health concern, especially for children. There is no safe level of lead or asbestos exposure. Health effects from lead exposure are irreversible, lifelong, and cumulative as exposure continues. These may include issues with hearing, speech, the brain and central nervous system, growth, and development. Learning and behavior issues can include lower IQ, decreased ability to pay attention, including ADHD, and underperformance in school. Asbestos exposure increases the likelihood of several cancers, including lung cancer and mesothelioma, laryngeal cancer, and ovarian cancer. In North Carolina, there are rule requirements to address lead and asbestos hazards at child care centers and public schools. The rules require facilities to 1. Test for lead in drinking and cooking water, 2. Identify lead-based paint hazards, 3. Identify asbestos hazards, and 4. Mitigate or restrict any hazards identified. Water mitigation is included in the program for fixture replacement and filter installation. For lead-based paint and asbestos mitigation, there are reimbursement funds available in full for child care centers and up to 2/3 of costs for public schools. As this is a legislatively mandated effort to address lead and asbestos hazards in public schools and child care centers, North Carolina facilities are required by law to make sure all requirements are met. American Rescue Plan Act funds are allocated to address lead and asbestos rule requirements, with approximately $150 million available from now until the end of 2026 for this program. Program organization is set up as follows. The North Carolina Department of Health and Human Services is managing the overall funding and contract. RTI is managing the overall program, including lead in drinking and cooking water testing and mitigation, lead-based paint risk assessments and testing, asbestos inspections, re-inspections and testing, and overall program management. Liaisons throughout the process include the North Carolina Department of Public Instruction and the North Carolina Division of Child Development and Early Education. For lead-based paint and asbestos, facilities choose whether to restrict or mitigate any identified hazards, and facilities can submit reimbursement requests to the North Carolina Department of Health and Human Services Health Hazards Control Unit for lead-based paint and asbestos mitigation. Next, we will overview the program at a high level.
I'm Ed Norman with the North Carolina State Health Department. I manage the Childhood Lead Poisoning Prevention Program, as well as the child care and school sanitation programs, as well as the lead-based paint and asbestos management programs. And we've recently received funds through the infrastructure ARPA state fiscal recovery funds that will allow us to test for lead in water, paint, and look for asbestos as well in public schools as well as licensed child care facilities. This expansion is made possible by a once-in-a-lifetime funding.
The objective of the Clean Classrooms for Carolina Kids program is to identify and eliminate exposure to lead and asbestos hazards where North Carolina children learn and play. To confirm who is included in this rule requirement and covered with available funding, this program is for you if you are a licensed child care center, a family child care home, or a public school or charter school in North Carolina. Facilities will be contacted for enrollment based on priority criteria. Prioritization is based on risk factors for lead and asbestos occurrence, the health effects of exposure, and funding need. Priority criteria include facilities that are child care centers or elementary schools, facilities where more than 50% of students receive free and reduced lunch, facilities where more than 50% of students are non-white, and facilities with one or more buildings built before 1988. Facilities will receive an email to enroll with RTI from the North Carolina Division of Child Development and Early Education for child care centers, or the North Carolina Department of Public Instruction for public schools. Note that all facilities will be contacted and able to enroll during the funding period. Facilities that would like to enroll before their prioritization category is up are welcome to do so, with the understanding that if we are currently at capacity with the existing priority facilities, we will provide a notification that there may be a wait to get to the next step in participation after enrollment. Once facilities receive the email to sign up, you click a link to join a pre-enrollment webinar at a time that works for you. This is that webinar. After this pre-enrollment webinar, you will receive the pin to enroll online at www.cleanwaterforuskids.org/Carolina. Once you log in, you will review the training for the lead and water, lead-based paint, and asbestos sections of the program, or ask a designated person to do so, because this will help you complete the enrollment surveys in the portal. We will notify you about next steps once you submit your enrollment surveys. This will come from our Clean Water for U.S. Kids program email address to the email you list during enrollment. Next, we will overview how to participate in the water section of the program. Per the North Carolina rule requirements, water samples must be collected using a certain method called EPA 3Ts. We provide clear training on how to collect water samples using this approach for each facility. Facilities must also restrict access to taps with lead results at or above the state action level until they are mitigated and samples confirm that the tap is safe for use. We provide sign templates and instructions. Facilities are also required to make results available for these taps. We provide an online facility data mapper and communication toolkit for use. Our program support includes the following key items for the water section of the program. RTI provides mail-out sample kits and prepaid return mailing labels, along with written and video instructions on how to collect water samples and ship them back. RTI analyzes water samples in our laboratory. We also return results with information on how to restrict access to taps exceeding the state action level. Lastly, we make results available online after 5 business days. Throughout the process, RTI provides ongoing communication support. You can check out our FAQs or call, text, or email our contact page for support. Mitigation support for water includes installing faucet fixtures, water fountains with bottle fillers and built-in filters, and the installation of lead-certified filters when needed. It does not include water filter maintenance, piping or plumbing changes, or lead service line replacement. If additional mitigation is needed, there may be supplemental funding available from the State Department of Environmental Quality or your utility. An overview for the lead and water section starts with attending this pre-enrollment webinar. Afterward, the primary facility contact will review the water training video to complete the online survey. We will subsequently send a sample kit or kits to your facility. Next, trained facility staff collect and ship samples. Once the kit is received, our team analyzes the water samples, then sends results and recommendations. Facility staff should notify the community about the program throughout the process and also after results are available. The link for our online facility data mapper can be used to share results. For any taps exceeding the lead action level, risk mitigation will then be conducted. We will also provide recommendations for lead results below the state action level. Okay, who should complete the water enrollment survey for your facility? One or more staff familiar with the facility's building layout, water usage patterns tap to tap, and the ability to collect and ship water samples properly. There are 6 sections of the water enrollment survey. Information is needed on building information, student demographics, the name and the location of all drinking and cooking taps, the name of other taps in the facility, and water filter type and brand if you have any, and your drinking water supply. All facility results will be available on the online facility data mapper 5 business days after results are directly provided to facilities. This allows facilities to restrict taps as needed and start the mitigation process, while also making it easy for facilities to communicate results to staff, parents, and students. The program results summary is also updated in real time online and shows facility enrollment, completion, and corresponding results in aggregate for the program. If we find that a tap at or above the state action level of 10 parts per billion is at your facility, water mitigation is required, and the program will contact you to coordinate mitigation. In the interim, the facility should restrict the tap by turning it off, taping the handles, and posting a sign. We will provide a sign that can be used. The facility can choose whether to receive materials only and use your own facilities or plumbing staff, or whether to use program team support to replace faucet fixtures or water fountains, and when needed, install a lead certified water filter on critical taps. If a tap is found to have lead levels at or above 150 parts per billion or more, we will ship another sample kit for 2 follow-up samples to further investigate the source of lead. Facilities will also receive recommendations for results below the state action level. You can find out more about our recommendations and mitigation process in our water section training in the portal, our videos, and our how-to page. After water mitigation for taps at or above the state action level, local and regional environmental health specialists will coordinate with the facility to visit on-site and collect samples for the mitigated taps. The samples will be directly sent to the state lab for analysis. Facility staff only need to coordinate the on-site visit. The results will be shared directly with the facility and also online after 5 business days. If water is still at or above 10 parts per billion lead, please post "Do not use" signage and await additional support. The tap results can be shared with your utility and the North Carolina Department of Environmental Quality, in this case, to consider additional funding support. RTI will provide a drinking water management plan template for all facilities, and you can individualize this for your facility. This can include plans to flush water after breaks and maintain any water filters, for example. Next, we will overview the lead-based paint and asbestos participation process. Let's overview key lead-based paint and asbestos requirements and support now. Per the North Carolina rule requirements, on-site inspections are required at facilities by certified and/or accredited professionals, or facilities should submit documentation during the enrollment survey of prior inspection or building age exemptions for verification. Our team will conduct on-site inspections and/or review documentation. Facilities must also restrict or mitigate identified hazards and also make results available. We will provide recommendations and also our online facility data mapper and communication toolkit for use. Program support includes the following key items for the lead-based paint and asbestos sections of the program. Our team will review and verify submitted documentation and coordinate on-site inspections if needed. We will also provide recommended actions for restricting any identified hazards. In addition to sharing results directly with the facility, we will also post results on the facility data mapper after 5 business days. Mitigation support for lead-based paint and asbestos includes reimbursement for up to 2/3 of the cost for schools and in full for childcare facilities. And this includes the pre-K, Head Start, and after-school programs within schools, the full reimbursement. The first step for the lead-based paint and asbestos sections is to attend this pre-enrollment webinar. Afterward, the primary facility contact reviews the training videos to complete the online surveys and upload specific documents if needed. Once complete, our program staff will coordinate the review of your survey and may assign a certified and/or accredited professional to visit your facility and collect samples as needed. Any samples will be analyzed at an RTI designated laboratory. We will provide you your results and recommended next steps directly in the portal, where you can determine whether to mitigate or restrict access to any identified hazards. Facility staff should notify the community throughout the process and share results and plans for restricting or mitigating hazards if identified. Facilities can then request reimbursement for mitigation funds. Okay, so who should specifically complete the lead-based paint and asbestos enrollment surveys for your facility? One or more staff should be familiar with priority facility inspections. Also, staff that could oversee efforts to restrict or mitigate hazards, and the local education agency's AHERA designated person for schools. The key sections of the lead-based paint and asbestos enrollment surveys include sharing information on building information and student demographics. If you or your staff in your school have already filled out building or demographic information, though, in a different section, you won't have to fill it out again in the next enrollment survey. We also need information on that previous inspection information if you have any concerns about lead-based paint or asbestos exposure, past or planned building renovations, and any documentation that you have for prior inspections, building exemption age, or anything else that you think could be of use. Reimbursement funds are now available for lead-based paint and asbestos mitigation completed on or after April 29th, 2022 until 2026 or resources expire. This is for up to 2/3 of costs for schools and in full for childcare facilities. For more information on covered activities and how to apply for reimbursement, go to the website shown here or QR code. Information is also on our program website. Now we will cover some helpful resources and tips to successfully prepare and complete enrollment. Our first tip is to engage your community throughout the process. Before water sampling or on-site visits, inform your community about your participation in the program. You can view our communication toolkit to help. After completing the program, you can share results and mitigation plans or actions with your community. You can also view our communication toolkit and facility data mapper to help you in this process. We also have a frequently asked questions page where we house lots of questions for program participants, and you can check that out first to see if there's an answer to your question there. If after today and our live question and answer session ends, you have a question or comment and you can't find the information you're looking for on our website or our FAQ page, you can also contact us by calling and leaving a voicemail or texting 1-888-997-9290. Again, that's 1-888-997-9290, or you can complete a form on our Contact Us page. You can also watch this video and others on our training and resources page. You can find the communication toolkit, other documents and resources there. You can navigate to these different resources on the page using the tab illustrated with the arrows on the screen. So how do you specifically enroll your facility? Well, it's by individual facility, not by district. You also choose who you would like to participate in the process. This could be an administrator, facility staff, or more, and can vary by program section. This could also be one person or a different person per section or a group of people. Parents and teachers can also support the program for the water testing process if they review the water training in the portal. Once you receive the PIN at the end of this live webinar, you can subsequently enroll online. This is the conclusion of the pre-enrollment webinar. Are you ready to enroll now? Before we start the question and answer session, the enrollment PIN that you will use to log in is being placed in the chat now. We will also share it at the beginning of the Q&A session as well. We ask that you do not share this PIN to individuals that have not watched the pre-enrollment webinar. To enroll, you will go to www.cleanwaterforuskids.org www.northcarolina.org/Carolina. Then click the blue Enroll Now button. Before we conclude, we'd like to thank the North Carolina local and regional environmental health specialists, our liaisons, the North Carolina Department of Child Development and Early Education, and the Department of Public Instruction, school and child care staff, and you. Thank you for helping to identify and eliminate exposure to lead and asbestos hazards, where North Carolina children learn and play. On behalf of the Clean Classrooms for Carolina Kids team, thank you for joining and taking steps to protect children's health from lead and asbestos hazards. If you have any questions, please contact our team at www.cleanwaterforuskids.org/Carolina or call or text 1-855-997-2864. Again, 1-855-997-2864. Okay, we are now ready for the live question and answer session. We will write the enrollment pin in the chat and verbally state it here as well. If you have any questions, please place them in the Q&A or chat box, or alternatively, you can raise a virtual hand for us to unmute you. We are happy to answer any questions you may have. If you don't have any questions or comments, you are free to exit the webinar.